Hey everyone, my name is Amanda. I'm one of the owners and instructors of Cornerstone Dental Assistant Academy. We're coming to you today to discuss what our 13-week program offers and how you can jump into the career after high school as a dental assistant. I personally also have been a dental assistant for 22 years. About 10 years, I returned back to school and also am an expanded function dental assistant as well. We can go into some conversation what that entails. So as we're very prideful that in our program that you're learning from instructors that have fully committed our careers to being a dental assistant too.
And I'm John, one of the owner instructors of the school as well. I've been a dental assistant for 30 years now. I joined the military right out of high school, and this is what the recruiter picked for me. So I love it. And in 2021, we were approved to open this school. So since we've had approximately 70 students pass through our doors. So some of those students are high school students, so you might be thinking to yourself, what am I going to do with my life as you're sitting there? And that's what we wanted to come today to talk to you about.
Yeah, so if you're a high school student and you are considering, we're most commonly talked about going to college and getting a 4-year degree, right? That's across the board, probably our most natural conversation from sometimes our counselors, from our parents as incentive. But maybe you're thinking that's just not something that you want to do, whether it comes to financially or also the commitment of time. Uh, is it something that you want to commit for the next 4 years as you're not even sure where you want that path to go? So our program here is a private licensed trade school secondary program. So we are a hands-on skill as a dental assistant, and our program being 13 weeks, and you also only attend class with us 1 day a week. We have 2 locations, so that day of the week varies, whether a Monday, Wednesday, or Friday. So, of course, it is a long day that we're reviewing a lot of information within our school setting. So, there is still some home time and study time that you're going to have to put in, uh, whether for studying on the weekends, an hour or two during your week, and compiling all that information that we are lecturing from on our Friday time.
So the first thing you might ask yourself is, what is a dental assistant? Well, a dental assistant is someone in the office who assists the dentist typically on procedures, take x-rays, handles the sterilization, infection control aspect of the office. So there's a lot that goes into being a dental assistant. So, and then of course you do have to put your hand in someone's mouth. So, if you're saying right away, maybe that's not for me, but we do find a lot of people are interested in teeth. So a lot of our students, once they get into the program, the interest is peaked and it grows from there. So you might ask yourself, okay, well, Amanda mentioned 1 day a week in person. So what does 1 day a week in person entail?
Yeah, so our students that come to class with us, of course, we have a classroom lecture. John and I are the only two instructors, so you're only going to see our two faces that are going to be hosting that lecture. And then we also have a mock dental practice within our school setting, which at the end of this video, you'll get a tour. So we have the dental chairs, we have x-ray equipment, we have dental instruments, we have an area where we teach infection control with proper sterilization to make sure that those instruments are ready for our next patient as well. Uh, we also are practicing impressions. We practice those on just as each other. Sometimes John and I are the patient as well. And also 3D scanning. So that's a more an advanced part of dentistry now with, you can think of maybe 3D printing. There's a 3D scanning involved. So we are partnered with a great company, Yeah Dental, that John is also a dental rep for, that we're able to utilize that equipment and bring you the most advanced dental experience. We really want our students to be prepared and having as much exposure in our 13-week program. So when you land that dental assistant position within a dental practice upon graduation, that you have seen a lot of dental products, a lot of dental tools, and a practice of setting up that procedure. As John said, a dental assistant, we're assisting that doctor. So how do we set up that room? What does that doctor need? How do we, hook up the suctions? How do we hook up that dreaded handpiece? How do we put together a syringe for an injection, that dreaded shot that we all hate? So as much hands-on exposure that we can get, we will expose you within that dental classroom setting as well.
So the program is 13 weeks. So at the conclusion of week 6, the start of week 7, you do have to complete a 60-hour externship in a dental practice. So we have a lot of offices that have signed on to host an extern. For some reason, they're not on the list. That's just something that we have to talk to them about so that they understand a student is coming into their practice. Sometimes people say, hey, my uncle's a dentist, or I want to go to my dentist. That's not an issue. We just have to make sure the Department of Education knows that that office has agreed to accept the student. So there are plenty of opportunities out there as dental assistants getting their foot into the door. But then from there, there's a lot of opportunities to move upward.
Yeah, so that externship is not a job shadowing. That is actually a hands-on period of time that during that 60 hours, a dental office is sort of taking you underneath their wing, that they're putting you with the doctor, they're putting you with a lead dental assistant, and they're helping you as an extension of what you've already learned with us about how to set up that room in a real dental practice setting, how to hold the suctions, and naturally there's a form of really a lot of jitters and nervousness that is very overwhelming at the beginning, as John already said, of really putting your fingers in someone else's mouth. It's awkward. It's very close personal also in someone's personal space, so it's a barrier that we really have to trim down, and it happens actually fairly quickly. So that extension of that externship is really going to help you. And a lot of those light bulbs that we see go off during that externship period by all that lecture time that we had in those weeks 1 through 5 as well. So where can we work as a dental assistant? Right? There's many job opportunities out there, not just limited to your hometown dental practice. So what are some examples? John, where have you worked?
Well, like I said, I was originally recruited into the Air Force. Got to see the world with that, and then from there, worked in small, Dr. Smith's practice down the road. Then, of course, a large corporate office. That's actually where Amanda and I met. We got a job together in a large facility, and most recently, I'd worked in the VA hospital system. So, a lot of different aspects. What about you, Amanda?
So, of course, yet again, small town practice, corporate dentistry. I also worked in a prison system. So I worked at a state prison where I was a dental assistant there. You can work at a county prison. You can work at a federal institution just outside of Morgantown, Pennsylvania. You could land a position at a hospital. In the Pittsburgh region here, we have Pittsburgh Children's Hospital, AGH, Montefiore. They all have dental practices within the hospital setting that you don't have to be a patient within the hospital to get an appointment. It's, the surrounding community people that are making appointments to go to that dental clinic. There's mobile dental units that you were working pretty independently on your own with a doctor, and you're visiting maybe some nursing homes. So you'll get your schedule for the next couple weeks, and there's actually a company that provides you with a van, and you have all the dental supplies. So if you don't have a vehicle, that's no wear and tear on your vehicle as well. And they pay for gas, they pay for their mileage in the sense. And then you're visiting that you're visiting that nursing home, skilled facility to perform exams, cleanings, maybe extractions, maybe different procedures if they're wearing a denture. So many different avenues that you can get into a dental assistant position, and also specialties. You can work at a practice that they just focus on doing root canals. It's called an endodontist. There's an office you can work just called oral surgery. That was my first practice actually as a dental assistant, that you are extracting a lot of teeth, but you're also doing Botox, you're doing facelifts, you're doing nose reconstructions, things of that nature. You can work in orthodontics. So those high school students that have braces on your teeth currently, or maybe have experienced that you can work in an orthodontic practice, which is typically a really high pace practice because they see potentially between 90 and 100 patients a day. So it's a very, very busy practice. And then I had one more thought.
Well, you have perio.
Perio is just focusing on gum disease. But regardless, the job community as a dental assistant is growing according to Bureau of Labor statistics, that are studies that show that our field as a dental assistant is growing significantly over through the years of 2027, 2028. Those numbers have increased even more after the post-pandemic, which there was a huge surge of people not getting back into healthcare system, such as the dental assistant field. We are proud to say that our completion rate for our students graduating is at 100%. So we've graduated almost 70 students in the last 3.5 years. We have had a few students withdraw, that they got into the school and they're like, maybe this isn't for me. But our students that have stayed enrolled, we are at 100% completion rate. We are about a 90%, 97% placement rating of also students landing a dental assistant position. Some of our students just haven't chosen which direction they want to go to. And within our program as well, you have to be radiology certified, which is certified in order to take x-rays here in the state of Pennsylvania. And that's a national exam that you have to pass upon graduation as well.
Yeah, so if you're thinking to yourself, hey, this sounds great, what do I have to do? Well, the first thing you want to do is contact the school. You can reach us at 412-779-2843. You can also check our website at cornerstonedentalassistantacad.com. Now, as far as opportunities go, we get a lot of calls about, hey, do you accept any type of scholarships or grants? Currently, our accelerated program is not long enough to be accepted for FAFSA. That's typically a question we get a lot. But we are approved for a state grant, the Workforce Innovative Opportunity Act, which if you are eligible, you can come to school at no cost. So that's a great resource that a lot of students have been taking advantage of. And then if for some reason you're not eligible, we do have a couple other opportunities. We work with a student loan company, and of course, we take payments here at school.
Yeah, so there's many, we do not have any prerequisite classes to get into our program. We do not have a prerequisite of a GPA. So there's no college courses that you need to take to get into our program. If you're naturally watching this as a high school student, we do not take into consideration what level of math or science that you're in or reading class. If you are going to take the steps to try to get that Workforce Innovative Opportunity Act that's going to cover the tuition, you would need to contact your local Career Link office, which after you contact us, we'll give you those names and numbers of who those people will be. And then there will be a math and reading exam that you'll have to take. So what is our tuition and how do you get in? Our tuition is only $4,800, so $4,800. It includes all the dental supplies, all your PPE, which would be your safety glasses, your mask, any of the dental supplies that we use in our school setting. We use 2 textbooks. The textbooks are included in that tuition. You get CPR BLS certified at the end of the program on week 13. And in the state of Pennsylvania, you have to be radiology, health, and safety certified in order to take x-rays. That national exam fee is $275. That is an exam done by the Dental Assistant National Board. So you can see information with that on danb.org, danb.org. And you have about a 60-day window post-graduation from our program to take that radiology, health, and safety exam that gets you legally allowed to take x-rays in the dental practice.
Yeah, so a lot of great value packed into 13 weeks. And it's one of these things that we've had students watch class after class after class. And then finally they join and they say, wow, I wish I would have done it, because it does go fast. So if it's something that you think, hey, 2 4-year school isn't for me, maybe an accelerated program, trade school is what I'm looking for, you should give us a call, because we do free consultation. Make sure you're interested, make sure you understand what's going on, and we can talk about those opportunities.
Yeah, so sometimes we'll schedule a meet and greet. So follow us on social media. We have Facebook, Instagram, even TikTok. So we always keep that up to date, of course, along with our website. We completely understand that sometimes a parent wants to come along with you and see our school and where we're located. We are located in downtown Washington on Main Street currently. So, bring along a parent, bring along a friend. There's no commitment if you just meet us here in the classroom. If you have questions, comments, concerns, of course, you can find our contact information also on our website. But we'd love to give you that opportunity, and we thank you for the time of also, we want all of those high school students to know that there are other options out there, that if you do not want to commit to that 4-year program, that a post-secondary school such as ours is going to get you prepared for a career upon graduation.
Yeah, so why don't we give you a virtual tour so you can see what it is that you're coming into?
All right, watch the tour next. Hey there, it's Amanda, an instructor here at Cornerstone Dental Assistant Academy. This location is located downtown Washington. We're on Main Street. I can actually see Washington and Jefferson College in the distance. We're giving you a tour of our facility. What does our classroom look like? What do we have inside? So come on in. Hey everyone, welcome in. This is our classroom here at Cornerstone Dental Assistant Academy. As you can see, this is where our students will sit in order to receive the classroom lecture from myself or John Hatfield. Again, we are the only 2 instructors. So our classroom lecture will always be held by one of us. We have our Freddie the Flamingo in classroom today. Our Fridays here, or even our upcoming Mondays, are held from 8 to 3:30. And also come inside. This is one of our dental operatories that we have. As you can see, we have the dental chairs. We have a unit to where we can practice setting up our room for the dental procedure. We have our dental unit as well, to where we'll practice setting up our suctions, our hand pieces. We have also an x-ray dental unit or dental x-ray unit in order to practice being able to take x-rays on each other as students as well. So this is the area that we have as much dental experience or as much dental equipment that you have are going to be able to use even in your dental setting. So whatever you can learn here, such as taking impressions on each other, practicing x-ray placement on each other. We do not expose our students to unnecessary radiation, but we really want our students to be expected of how our doctors are going to want us to perform as a dental assistant here in our classroom setting. So what you see is our mock dental operatory. We have 2 of these here in our school setting. So sometimes we'll do a classroom lecture, and then we'll come back and forth into our dental operatories and get some hands-on practice as well. So follow me. Of course, our classroom is filled with a lot of dental knowledge on the wall, of some posters to help our dental assistants get some knowledge, even while they're maybe waiting for other students doing practicing while they're in the dental operatories. Within our dental assistant education program, we also are doing some lab work. So even though we are exposing and teaching our students 3D scanning, that we're still practicing impressions. So we're taking alginate impressions on each other, and then we're pouring models, talking about how to make some whitening trays or some bruxing splints as a dental assistant. So how to do some of those skills that we would do in our real life is what we're practicing here as well. And of course, one of our first duties as a dental assistant is probably infection control. So sterilization is very, very important to make sure that we're understanding how that sterilization works. So we have our dirty side where we talk about our ultrasonic, properly bagging our instruments. In the sense, paper up or paper down is always a key question in our social media. How to use an autoclave, the proper temperature, being used as distilled water. So what does this process look like from our dirty side to our clean side? Infection control and sterilization as one of those components that we see commonly that has some mistakes. So we really want to focus on our students learning and have a great vast knowledge of how extremely important that infection control and that sterilization process is as a dental assistant. In our classroom as well, we have our AJ Snack Shack, which we love. So of course we're here for a long 6 or 7 hour day. So if you need some snacks, have your lunch while you're here in our classroom. Downtown Washington is a growing town. There's some great local restaurants that our students can attend and go on their lunch break. But this is our classroom setting. We are very prideful on what we can perform and what we can expose our dental assistant students here in the classroom, as John and I are your instructors, and we are dental assistants too. So we look forward to seeing you at an upcoming class. Enrollment is open, so please apply today.